The National Association of Seadogs is stepping in to provide critical health care support to a rural community in the Federal Capital Territory. Over the weekend, the group, also known as Pirates Confraternity, held a free medical outreach in Kukwaba village under Buari Area Council. The outreach was organized by two of the association's local chapters, Zuma and Sahara decks. Over 200 residents received medical services, including blood pressure and glucose checks, laboratory tests, and general consultations. Organizers say the outreach was not only necessary, but urgent, especially for a community with no government-owned healthcare facility nearby. The closest hospital is about 18 kilometers away. The outreach also coincided with two major milestones for the group: the 91st birthday of Nobel Laureate and founding member Professor Wole Soyinka, and the 40th anniversary of medical service by Dr. Joseph Oteri, NAS Capoon, and a strong advocate for accessible healthcare. Dr. Oteri, who has been in medical practice since 1985, said the initiative reflects the organization's long-standing commitment to serving undeserved communities. He noted that NAS began its medical mission nearly 3 decades ago in Rivers State and has since held regular outreach events across the country. He stressed that the group focuses on sustainable impacts by identifying each community's specific health needs, sourcing medications, and deploying volunteers team made of doctors, nurses, and community health workers.
NAS on its own have been doing a lot of medical outreaches. In 1996, I did an outreach in Rivers State, right, while I was still in Port Harcourt. And after that, we'll be doing outreaches at every quarter when we go for our quarterly meetings. So this is just to show that since you were in charge of all those outreaches, let us celebrate you with an outreach. So this is what we've done. I didn't know when they were planning this.
Who are your targets?
Community. Most times, what we do, we support the downtrodden, right? People that couldn't afford some things are the ones we actually target. So if you look at most of these people here, some of them might not even have access to paracetamol if they go to a clinic. So we felt, okay, let us bring all the things they need.
Victor Chukwuemeka, medical officer of Zuma DEC, called the situation unacceptable and emphasized the need for immediate government interventions. According to the group, plans are on the way to expand future outreach services to include eye care, maternal health, and chronic disease management. NAS leaders say they are also engaging the Federal Ministry of Health to push for a fully functional primary health care center within 2 kilometers of Kukwaba.
To start, we're attending to the basics. Free medical checks that would help us indicate whether you're hypertensive, diabetic, the sicklers that don't even know their status. They're always in the hospital. We have 2 cases that we've identified this morning that are sicklers. They're always in their local hospitals. They give them markings and all that, without knowing that these guys are actually sicklers. We're also offering our lab interventions that will help us detect all these things. The basic investigations, the lab, the full blood count, the panels, hepatitis panel, HIV panel, all of those, so that you know where you are, so that we can go from there.
Obinna Udenzi, area mate with the Area 9 Command, says giving back to the society is at the heart of their mission. He hopes the outreach sparks broader investment in rural healthcare infrastructure.
So we organize this outreach to honor both of them. We think that as a social advocacy organization, the best way to honor them is to come to the less privileged, the underserved, to make sure that we also offer some help to them. So essentially, we decided to come to Kukwaba village in Kubuahia to do this medical outreach.
Local residents shared emotional stories during the event, reporting death from untreated conditions like hypertension and women forced to deliver babies at home due to lack of medical access.
1 year plus now. If I'm sick, I do go to like all those big pharmacies from DBA. If the sickness is much, I'll go to all this private hospital. So the general hospital is far from this place, very, very far. That is it. Some of them that they don't have a private, that they cannot go to private, they don't even have money. Sometimes they do go to pharmacy and just get you can see that what they are sick for, they're supposed to spend like maybe 40,000, 50,000. Due to say they don't have money, there's no primary health care here, they will just go and afford something of like maybe 5,000, 3,000 to just take good care of themselves.
The National Association of Seadogs say it remains committed to long-term advocacy and grassroots service, especially in communities where the need is greatest.